Nursing is a profession that you can use every aspect of yourself. You can be caring. There's a technical side to it. There's the math and science. There's connecting with people. That's what's most important. When people are coming in and when they're sick and they're ill, they really need to have someone that they can connect to. I really wanted to make a difference, and it seemed as if the nurses that I met that had worked in the emergency department, they were awesome, and I wanted to have that same awesomeness, if that makes sense. In the emergency department, we don't know what's coming in the door. It can be something as simple as someone has a headache to a trauma. When patients come in and they are at, a lot of times in the emergency department, they're at a really low point. And being able to talk to them, help them get to a point where they're feeling better, that's the best part of my job.
Come on in and have a seat. Usual spot. You want to slip your coat off. We'll get your blood pressure, all that stuff. Pain management is a unique field because people have pain, and to them that signifies the end of independence for some of our elderly people, or somebody young in their 30s, say they had 3 or 4 back surgeries. They're looking at a vocational change, they're looking at financial changes, it impacts their family. We're looking at people not only from a physical aspect, but we're looking at their emotions, we're looking at their social dynamics, and so having a play in that multidisciplinary role, you're almost with the doctor kind of quarterbacking their care. Putting myself next to them, try to put myself into their shoes, have empathy for what they're going through, help them understand the medication they're getting, why we're waiting to do certain treatments, why we're pushing to do other treatments, help them to deal with the whole process. But you're not doing it alone, you're doing it with a team, and you're part of the process. And again, it's making that difference in somebody's life.
I have been an Aurora nurse since 1989. I've tried other ventures, but I've never left Aurora. I love working for them. I love how they look at the patient as a whole, with the encompassing the family and encompassing us as the nurses that take care of them. I love it. I love going to patients' homes, and it's one thing when you receive a patient in the ER, you don't really know where they came from or where they're going back to, but in the house you see what's going on in their lives. You can put what's going on with their health status as far as their living conditions, their family conditions, their support systems, and we can put it all together. The best part of my job is helping people heal, helping people get safe in their house and be able to stay there, recover in their house due to shorter hospital stays. So we just assist in their healing at home. I'm very proud to be an Aurora nurse. I've spent all my career here, and I don't see me going anywhere else before retirement, which is a long way off, I'll say.
Hi Deborah, you ready to chat? The best part about my job is working with the patients and their families and developing long-term relationships. I really feel that I have an impact on their health. Some of them will tell you it's not always the doctor, it's the nurse. They know who I am, they call me when they have problems. There's some patients I know I just have to call every month just to check in and see how they're doing. It's just a great relationship, you get to know them. We have a lot of learning opportunities. There's partnerships with different schools or just different community. Here on Tuesdays we do a difficult case where we talk about either patients of ours or patients from outside. I'm very happy I made this choice. I love my job. I don't see myself changing jobs anytime soon. I feel like this is the place I'm going to be probably until I retire, if I ever get to retire. We joke that we'll be here until we're patients. It's more than just a title, it's not a job, it's almost a feeling, it's just who you are. I mean, there are people who are nurses, but being a nurse is something that's special. You really have to care about somebody else and put them before yourself.